Hello, my name's Kate Power, and together with my University of Queensland colleague Peter Crosthwaite, I'd like to thank you for watching this presentation. In this paper, we provide a corpus-informed analysis of Jacinda Ardern and Scott Morrison's public communication about COVID-19 between January and December 2020, which demonstrates the highly situated and emergent character of political discourse and helps us better to understand how two very different politicians managed communication around this pandemic. Our goal in pursuing this research was to identify similarities and differences in these leaders' communicative style at the lexical level and to trace microdiachronic changes in keyword usage throughout 2020 in relation to the unfolding epidemic curve in each country. The figures on this slide depict those curves, showing that both countries benefited from their island status, gaining some lead time before the first COVID-19 cases hit their shores on 25th of January in Australia and 28th of February in New Zealand. Both countries also experienced a sharp but relatively small early spike in case numbers, which quickly dropped away as their leaders took a go hard and go early approach to the virus. This initial spike was followed by further localised outbreaks. In Australia, the state of Victoria experienced a second significant wave of community transmission between July and October, and in New Zealand, a smaller outbreak in the city of Auckland occurred in mid-August. Both countries have been very successful in managing this pandemic. In February 2021, New Zealand was deemed the most effective nation in the world, with just under 2,000 confirmed cases and 25 deaths in a population of 5.1 million. Australia came in at 8th place, with just under 29,000 cases and 909 deaths in a population of 25.7 million. In this study, we retrieved every document published on Scott Morrison and Jacinda Ardern's official media relations websites during 2020. Focusing on monologic genres that related directly to COVID-19, we generated a corpus of 86 documents, which we organised according to publication date, colour-coding texts in line with the epidemic curve in each country. We then used scatter text to visualise lexical differences between each subcorpora set and mapped the frequencies with which COVID-19 and related keywords were mentioned in each subcorpus against the respective epidemic curves, with the statistical significance of certain identified keywords derived using the log likelihood calculator. While the two corpora are relatively small compared with most corpus-based discourse studies, the analytical techniques used have been shown to be robust on corpora comprised of only 3 texts with word token counts in the hundreds. The figure on this slide visualises our findings for the corpus as a whole. To summarise, National Cabinet and variants are key for Scott Morrison, as are both aged care and support. By contrast, the most significant keywords for Jacinda Ardern are alert level and variance, although the prevalence of if statements as well as the pronouns you, your, and we can is also noteworthy. These results point to 2 important differences between Morrison and Ardern. First, their lexical choices create 2 very different representations of agency around management of the pandemic. Second, these choices also reveal very different construals of what issues were salient. With respect to agency, Morrison frequently positioned National Cabinet as the censor, actor, and sayer of mental material and verbal processes. In short, as the agent responsible for decisions, actions, and statements about managing the pandemic. National Cabinet also appears as a circumstantial element, indicating the location and manner in which Australia's national and state or territory governments collectively managed the pandemic. As Miriliotta and colleagues observe, these references to National Cabinet enabled Morrison to, quote, selectively assert his political relevance at a time when many of the most important decisions and actions that affected citizens during the pandemic fell constitutionally to the states and territories, end of quote, at times claiming credit, but at other times disavowing responsibility for decisions made, actions taken, and statements uttered. By contrast, Jacinda Ardern's frequent use of pronouns displays a highly interpersonal rather than structural or governmental perspective on who was both acting and responsible to act throughout the pandemic. As politicians globally often do, Ardern repeatedly used the first-person plural pronoun we as an inclusion strategy, combining it with the modal can to construct an image of what is or might be possible. In some cases, she used exclusive we, displaying her institutional identity as Prime Minister, speaking on behalf of the government. More often, however, she uses a patriotic we, what Wales calls a patriotic we, speaking on behalf of both her government and the general population to invoke a general collective response or attitude, Allen 2007, and, quote, to co-implicate, end of quote, Bramley 2001, New Zealanders in both the government's pandemic management and the benefits that might flow therefrom. The keenness of you and your in Ardern's messaging is particularly noteworthy here, as is her frequent use of if-you statements. Previous research suggests that you and your are seldom used in political discourse, perhaps because they create distance between politicians and the population by categorising them, quote, as belonging to two separate groups, I versus you, Halmari 2008. However, because you and your always include the listener, they can be used to appeal directly to an audience, building solidarity and reducing rather than increasing distance. The second main difference observable at the lexical level concerns the key issues faced and made salient by each leader. For Morrison, the fact that 75% of Australia's COVID-19 deaths occurred in aged care homes presented a major challenge. While the total numbers of aged care cases remained low on a global scale, the rate of infection was one of the highest worldwide. Moreover, it shone a harsh light on a sector already beleaguered by its heavy reliance on, quote, a low-paid casual workforce who go from home to home, Cousins 2020, insufficient regulation and staff training, and an extensive network of private for-profit providers ill-attuned to both disease control and human rights. The residential aged care sector accounted for a similar overall percentage of total COVID-19 deaths in New Zealand, 64%, but it didn't register as keyword in Ardern's messaging, perhaps because the real number of fatalities was much lower and represented only 0.04% of New Zealand's aged care beds, compared with 0.33% in Australia. What does loom large in Ardern's messaging, by contrast, is the 4-level alert system she introduced on 21st of March, which was informed by New Zealand's 20-plus year experience with volcano and other natural disaster alert systems. Ardern promised to use the COVID alert system whenever updating case numbers, and she made good on that promise by repeatedly referencing the system throughout 2020. Indeed, her early introduction of and consistent reference to this system was an important enabler of both public sense-making and distress regulation, and it goes a long way to explaining why Ardern has been so widely praised for clear communication throughout the pandemic. So, I'll turn now to specific phases of the epidemic curve in each country. During the white or pre-case period, words like coronavirus, Wuhan, outbreak arrival, symptoms, aware, measures, advice and risk were used very frequently. This pattern signals that both PMs, Prime Ministers, were already monitoring international experiences of the pandemic and preparing to limit its local impact before any COVID-19 cases were detected on their shores. However, the number of texts in our corpus for this period is very small, so these results should only be read as indicative. We have more data for Morrison, but not Ardern, during the green or initial case period, although the total number of texts remains small. During this period, Morrison spoke often of other countries affected by COVID-19, including China and Iran. Also prominent in his public messaging was the movement of people, with word choices like permanent and residents, as well as medical advice. These foci coincide with Australia's monitoring of international COVID-19 cases and resultant travel bans, and with its early commitment to be guided by medical advice. Like Australia, New Zealand closed its borders to international arrivals during this initial case period because, as an island nation, all of its cases to date had come from overseas arrivals. However, Ardern's distinctive keywords at this time convey a very different perspective concerning personal references expressed in words like your, we can, and people, as well as regional sensitivity expressed in the word Pacific and scalability. These patterns arguably encode a more humane communicative style than seen in Australia. One final point worth noting about the initial case period is this. The World Health Organization announced official names for the virus responsible for COVID-19 and the disease it causes on 11th of February 2020. From that point onwards, throughout 2020, Ardern mentioned only COVID-19, the official disease name, but Morrison referred to both coronavirus and COVID-19. Although small, this difference suggests a level of precision in Ardern's public communication that was lacking in that of the Australian Prime Minister. During the red or steep curve rising periods, National Cabinet and aged care loomed large in Morrison's messaging. Morrison spoke often of both COVID-19, frequently choosing words like outbreaks and coronavirus, as well as the steps needed to flatten the epidemic curve, expressed in words like quarantine and social distancing. Morrison continued to use the phrase social distancing throughout 2020, despite the World Health Organization's announcement on the 20th of March that, quote, we're changing to say physical distance, and that's on purpose, because we want people to still remain connected. By contrast, Ardern began referring to physical distancing just one day after the World Health Organization and continued throughout 2020, demonstrating a concern to maintain and promote social closeness so as to protect the mental health of New Zealanders. I didn't mention that there is a quote from Aminejad Alikani 2020. This interpersonal focus in Ardern's communication continued throughout both of New Zealand's danger periods. Particularly noteworthy in this respect is her repeated use of the phrase I am, most often in semi-performatives, for sure in 1996, announcing COVID-19 advice or restrictions on behalf of her government, but also to express personal attitudes, her own personal attitudes concerning those restrictions. The pandemic phases depicted on this slide are those in which the daily case numbers decreased relative to each country's overall average daily case numbers. Australia experienced 2 of these yellow or curve flattening periods during 2020. New Zealand experienced 3, although only one of those periods contributed texts to our corpus. Several of the linguistic patterns found at other points along the epidemic curve recur during these periods. Some new foci are discernible, however, perhaps the most telling of which are that Scott Morrison frequently mentioned restrictions, whereas Jacinda Ardern frequently mentioned contact. Finally, Australia experienced 2 blue or flat curve periods during 2020, while New Zealand experienced just 1. During this period, Jacinda Ardern continued to use pronouns and if statements with considerable frequency, demonstrating the same interpersonal style and approach to guiding New Zealanders' behaviour that she used at other points along the epidemic curve. By contrast, we see some new features in Morrison's communication during flat curve periods. First, he frequently used the word reform, most often in relation to a new intergovernmental forum known as the National Federation Reform Council, which replaced Australia's previous mechanism for state and federal government cooperation in May 2020. Second, Morrison used personal pronouns with significant frequency only during flat curve periods. Unlike Jacinda Ardern, however, Morrison preferred the third person plural pronoun, that is, they, rather than you or we. He used this pronoun most often to refer to Australians, but also to Australian businesses, to measures adopted to prevent the spread of COVID-19, to people from other countries, to state and territory governments and government agencies, and to COVID-19 cases. In short, Morrison's pattern appears to be to speak about rather than directly to people, and to use they not only in relation to people. To conclude then, by using automatic extraction and statistical cross-corpora comparison of keywords, we have shown that throughout 2020, Jacinda Ardern used a highly consistent relational communication style while dealing with COVID-19, which prioritised building engagement with New Zealanders while guiding their behaviour with clear, precise how-to instructions. Burns, 1991. Ardern also displayed regional sensitivity to and responsibility for New Zealand's near-Pacific neighbours. By contrast, Scott Morrison's COVID-19 communication was more varied and seemingly reactive to the epidemic curve. Morrison also focused on government structures, lacked interpersonal engagement, displayed us and them thinking, and did not clearly guide Australians' sense-making and behaviour in relation to the pandemic by clear, consistent, precise communication. Thanks very much for listening. We look forward to discussing the paper with you.